Many people experience piles at some point in their lives. This condition affects millions globally, regardless of age or gender. Piles, also known as hemorrhoids, are a common health concern that often causes discomfort and worry. They are swollen veins in the lower rectum and anus, similar to varicose veins. Despite their prevalence, piles are often misunderstood, leading to unnecessary anxiety and delayed treatment. Many people feel embarrassed to seek help, which can worsen the condition. This essay aims to shed light on this common condition, explaining what piles are, their causes, symptoms, and the various treatment options available. Understanding these aspects can help demystify the condition. Piles can be uncomfortable, but they are usually not serious. Symptoms can range from mild itching and discomfort to more severe pain and bleeding. By understanding piles, you can take steps to manage the symptoms and prevent future flare-ups. Lifestyle changes, such as a high-fiber diet and regular exercise, can make a significant difference. This guide will provide you with clear and concise information about piles, empowering you to take control of your health. Knowing when to seek medical advice is crucial. Understanding your body and its signals is the first step toward effective management and treatment. Early intervention can prevent complications. Remember, knowledge is power, and being informed about piles can help you seek appropriate care and alleviate any concerns you may have. Stay informed, stay healthy. Piles are swollen blood vessels located in the lower rectum and anus. Imagine these blood vessels like tiny balloons that have become inflamed and enlarged. They occur when there is increased pressure in the area, often due to straining during bowel movements, chronic constipation, or diarrhea. Piles are very common, especially during pregnancy and as people get older. While they can cause discomfort, piles are usually not serious and often go away on their own, or with simple treatments. There are two main types of piles, internal and external. Internal piles develop inside the rectum and are often painless, but they may bleed during bowel movements. External piles develop under the skin around the anus and can be itchy, painful, and sometimes bleed. Understanding the difference between the two types is important for effective management and treatment. Piles often manifest with noticeable symptoms, although some individuals may experience them mildly or not at all. The most common symptom is bright red blood on toilet paper or in the toilet bowl after a bowel movement. Many people notice a lump or swelling around their anus, which may be painful or tender to the touch. Discomfort during bowel movements, accompanied by a feeling of incomplete evacuation, is another common sign. Itching and irritation around the anus can also be indicative of piles. While these symptoms can be alarming, it's crucial to remember that piles are treatable. If you experience bleeding during bowel movements, it's essential to consult a healthcare professional to rule out other conditions. Early detection and treatment can prevent complications and alleviate discomfort effectively. Several factors can contribute to the development of piles. Straining during bowel movements, often due to constipation, is a leading cause. This straining increases pressure on the veins in the rectum and anus, causing them to swell. Pregnancy is another common cause as the growing uterus puts pressure on the pelvic veins. Other factors include aging, chronic diarrhea, obesity, and a low-fiber diet. People who sit for long periods are also at increased risk, as this can restrict blood flow to the area. Understanding these risk factors can help you make lifestyle modifications to prevent piles from developing or recurring. By adopting healthy bowel habits, incorporating fiber-rich foods into your diet, and engaging in regular physical activity, you can significantly reduce your chances of experiencing piles. Section 5. Types of piles, internal and external. As mentioned earlier, piles are categorized into two main types, internal and external. Internal piles develop inside the rectum and are graded based on their severity, from grade 1, which is mild, to grade 4, which is severe. These piles often don't cause pain but may bleed during bowel movements. In some cases, internal piles can protrude from the anus, especially during straining, which can be uncomfortable or painful. External piles, on the other hand, develop under the skin around the anus, and are more likely to cause pain, itching, and discomfort. They may also bleed, especially if irritated. Thrombosed external piles, which occur when a blood clot forms within the hemorrhoid, can be very painful and require immediate medical attention. Understanding the type of pile you have is crucial for determining the most effective treatment approach. Section 6. Diagnosing piles, a straightforward process. Diagnosing piles is typically a straightforward process. It begins with a detailed consultation where your doctor will take the time to understand your symptoms and concerns. Your doctor will ask about your symptoms, medical history, and lifestyle habits. This information is crucial in forming an accurate diagnosis and understanding the potential causes of your condition. They will also perform a physical examination, which may involve a visual inspection of the anal area and a digital rectal exam. This step helps in identifying any visible signs of piles. During a digital rectal exam, the doctor inserts a gloved, lubricated finger into the rectum to feel for any abnormalities. This procedure is quick and helps in assessing the internal condition. This exam helps assess the size, location, and tenderness of the hemorrhoids. It provides valuable information that guides the next steps in your treatment plan. In some cases, your doctor may recommend additional tests, such as an anoscopy or sigmoidoscopy, to get a clearer view of the rectum and anus. These tests are particularly useful if the initial examination is inconclusive. These procedures involve inserting a thin, flexible tube with a camera attached to it into the rectum. The camera provides a detailed view of the internal structures. The camera transmits images to a monitor, allowing the doctor to examine the area in detail. This helps in identifying any abnormalities that might not be visible during a physical exam. These tests are generally painless but may cause some discomfort. Your doctor will ensure you are as comfortable as possible throughout the process, providing reassurance and support. Section 7. Treatment options, relief and healing. The good news is that there are several effective treatment options available for piles. The treatment approach depends on the severity of your symptoms and the type of piles you have. For mild cases, simple lifestyle changes and over-the-counter remedies may be sufficient. These include increasing fiber intake, drinking plenty of fluids, and taking warm baths. Over-the-counter creams and ointments can help soothe itching, pain, and swelling. For more severe cases, your doctor may recommend medical treatments, such as rubber band ligation, sclerotherapy, or infrared coagulation. These procedures aim to shrink the hemorrhoids by cutting off their blood supply. In rare cases, surgery may be necessary, especially for large or recurring hemorrhoids. Your doctor will discuss the risks and benefits of each treatment option and help you choose the best course of action for your individual needs. Section 8. Home remedies for pile relief. While it's essential to consult a healthcare professional for diagnosis and treatment, several home remedies can provide relief from pile symptoms. Warm baths or sitz baths, where you sit in warm water for 10 to 15 minutes several times a day, can soothe the area and reduce inflammation. Applying over-the-counter creams or wipes containing witch hazel or hydrocortisone can alleviate itching and discomfort. Ice packs wrapped in a towel can also help reduce swelling. Consuming a high-fiber diet including fruits, vegetables, and whole grains can soften stools and make bowel movements easier. Drinking plenty of water is also crucial for preventing constipation. Additionally, avoiding straining during bowel movements and not sitting for long periods can help prevent piles from worsening. Remember, these home remedies are meant to complement, not replace, medical treatment. Section 9. Preventing piles. Simple steps for a healthier you. Preventing piles is often easier than treating them. By taking proactive steps, you can avoid the discomfort and inconvenience they bring. By making simple lifestyle changes, you can significantly reduce your risk of developing this common ailment. These changes are not only easy to implement but also beneficial for your overall health. One of the most effective preventive measures is to consume a high-fiber diet. Fiber is essential for maintaining a healthy digestive system. Fiber adds bulk to your stool, making it softer and easier to pass, which reduces straining during bowel movements. This simple change can make a big difference. Aim for at least 25 to 30 grams of fiber per day from fruits, vegetables, whole grains, and legumes. Keeping track of your fiber intake can help you stay on target. Drinking plenty of water is equally important for maintaining soft stools and preventing constipation. Hydration is key to a healthy digestive system. Staying physically active is another crucial aspect of pile prevention. Regular movement helps keep your digestive system functioning smoothly. Regular exercise, such as brisk walking, jogging, or swimming, improves blood flow and strengthens the muscles in the pelvic area, reducing pressure on the veins. This can help prevent piles from forming. Additionally, avoid sitting for long periods, especially on the toilet. Prolonged sitting can increase pressure on the veins in your rectal area. If you have to sit for work, take frequent breaks to stand up, stretch, and walk around. This helps reduce the risk of developing piles. By adopting these healthy habits, you can maintain a healthy digestive system and minimize your risk of experiencing the discomfort of piles. Remember, small changes can lead to significant improvements in your overall well-being.